Hi, welcome everyone. Welcome to this webinar series with Studio B. I'd love to take a moment to just talk a little bit more about Studio B. My name is Jess Sambry, and I'm a facilitator with Studio B. Studio B provides mindfulness training to companies, nonprofits, and individuals. Through technology, our global team of teachers and experts teach and guide mindfulness skills to improve employees' well-being, reducing stress, increasing mental clarity, improving emotional agility, interpersonal communication, and strengthening resilience. We are reimagining collective well-being, challenging companies to redefine what it means to care for their teams, prioritizing whole health well-being as an essential employee benefit. So we're happy to have you here. The webinar today is the first in three-part series on mindful reboarding, strategies for a successful return. And it feels very timely to have this webinar here today. Today's topic is mindful reboarding strategies, developing a flexible approach during uncertain times. Our speaker is Dr. Tracey Meyers. Dr. Tracey Meyers is a licensed clinical psychologist, and in addition to being a senior facilitator at Studio B, Tracey works at Lawyers Concerned for Lawyers, a legal assistance program serving lawyers, judges, and law students. Prior to joining LCL, Tracey worked for the state of Connecticut Department of Mental Health and Addiction Services. She spent 16 years working with inpatient and outpatient individuals in mental health settings. Tracey has a strong commitment to integrative medicine and leads mindfulness and yoga programs for groups, individuals, and professionals. I want to talk a little bit about Tracey's forthcoming book, which is titled Yin Yoga Therapy and Mental Health, an Integrated Approach. This is an extensive guide to utilizing yoga and meditation to support mental health and well-being. And we are so happy to be with Tracey today. Tracey, welcome.
Thanks, Jess, and thank you all for joining us today. We were just saying before we started the webinar today about just the uncertainty continuing and hearing different companies pushing back their onboarding or reboarding dates. And, so I think this topic today about really thinking through reboarding and really looking at the workforce and what the data is showing about the workforce now and how we can best serve our employees, if you're an employer or if you're an employee, how to navigate these difficult times. And I really envision this as an ongoing dialogue. Of course, there's no absolute solution. And in fact, that flexibility is really key as we talk through today some of the challenges and some of the options to have this be a healthy return to whatever the new normal might be. So I'm going to share my PowerPoint now, and then certainly we'll have time for some discussion as well. So let's start here. Okay. All right. So we're going to talk extensively about the toll that the pandemic has taken on us, just so that we really know what our workplace looks like now and how we best can work within that system. We're going to talk about anticipatory anxiety, which probably a lot of us have when we think about returning to work or staying in our ongoing, home offices. That can also create anticipatory anxiety. Looking at the signs of distress in colleagues and ourselves, that's one thing that's really important to me. I work with a lot of lawyers and law firms and really looking at how do we support one another in the workplace. And then looking at this toolkit, which can always be added to, but how do we actually have a compassionate workplace within these difficult times? So we'll try to hit those points today. So the Gallup report came out in 2021 recently, and those of you who are probably familiar with Gallup polling, they did this global workplace report, which you can download here, the links here, really helpful in looking at what is the state of our workplace right now. And they looked across the world to see what are the patterns emerging during this pandemic, and what are some of the key things in terms of creating a healthy workplace. So I'm going to show you a little bit of the data, because the data is, and as a clinical psychologist, I'm always starting with the numbers. We don't know what to do until we know what we're working with. So we call this baseline data in psychology. Like where are we right now in 2021 August as we think about onboarding or reboarding, right? So the data shows that, especially in the United States and Canada, we have the highest level of daily stress. So they were surveying employees and asking people, how often do you worry? Do you worry on a daily basis? And here in the US, about 57% of us are worried on a daily basis. Women come in at a 62%. So nearly 2/3 of all women are worrying on a daily basis, that have enough stress that it creates a significant impact in their daily life. And then we can look at other things. So there's stress, there's worry. This is more that anticipatory anxiety, which I'm going to define in a few moments, because that's a particular kind of worry. And there's a big jump from 2019 to 2020. We're looking at a 10-point jump. You can see there's no other time over the past decade where there's been as big of a climb. Now, here's a couple of other interesting things. And again, in the populations that you work with, you may have noticed this: anger, right? That there's a lot more anger and frustration among employees, and especially for folks under 40. That doesn't mean that people under 40 are more angry in general. I like to think about it as the life demands, particularly for this younger age group, whether it be having young children or navigating financial stressors. People that are having more stress are prone to having more anger. So stress and anger are part and parcel. They're intimately related, both psychologically and also on a brain level, what's happening in the brain. Sadness. So we're looking more now around depression. And again, the numbers are pretty high overall. So 25% of folks are reporting daily sadness, which we might translate into clinical depression. Women, again, higher than men in terms of their sadness indicators. So here's like the whole piece of it. You can see now the trends from 2009 all the way up to 2020. And you can see really everything has increased significantly: anxiety, worry, sadness, anger. So this essentially helps us to understand our workplace, that our workplace is not well, that, over half of our employees are dealing with high levels of stress and anxiety, and, maybe a quarter are dealing with depression and anger issues. Final couple of things I want to share about this global summary. We looked at the daily negative emotions, that blue box here, right? And so this is now worldwide, not just here in the US and North America. Here are some other impacts of the pandemic. Life impact: 45% of people said their life has been impacted. Lost pay, working fewer hours, all these losses. So these numbers are really high, almost 50%. And then looking at that box here, employee engagement and life evaluation. And I'm going to spend some time talking about this as well. We often focus on the top two boxes. And I thought this report was so helpful in looking at, well, what is actually our overall well-being? What goes into that? How do we help people to thrive? So currently people are feeling less engaged. So employee engagement, feeling less engaged. Only 20% of the workforce feels engaged in their workplace. Like, that's really low. So that we already know is one area that we can continue to improve. When we see data like this, it always gets me thinking as a psychologist, rather than saying, oh no, that's terrible. It's like, okay. So we have this great population of people we could be helping to engage more. So if employee engagement is only 20%, we've got a lot of room to make improvements. How do we engage more so that we can help our employees feel more plugged into the job? And then thriving, which is, we're going to talk about what thriving means in the workplace. Only 32%, less than half. Again, good news, bad news. Bad news is that people are not feeling like they're thriving. Good news is there's so much opportunity to help people regain or learn, maybe for the first time, key skills to thrive. And then finally, this last box around environment satisfaction, social respect, social feeling, again, some of the impact of the last few years in terms of all of the things happening in the world with racial injustice, with corruption, and all these other things that have been happening, that also impacts overall feeling of thriving and well-being. So I think this global summary helps us to understand the problems we have, where our returning workforce is, and also some great areas where we can actually improve things. So there's some opportunity in the mix of all of this somewhat pessimistic global summary. So it's complicated, and we were speaking earlier about Amazon and Google are pushing back their reboarding dates. And I know, working in the law profession, a lot of law schools are rethinking, and schools and parents are scrambling. So we're in this really complicated place once again about how do we actually reboard and what is the timing around that. When we've surveyed, and I'm sure many of you have either been surveyed or are surveying your employees, there's this diversity, and usually it sort of stratifies around these three main areas. I never want to go back. Like, working from home actually is more productive, or it works better. The second is I'd like to be in the office 2 to 3 days a week. And then that last one, we all need to be 5 days a week. And for many of us, this switches. So I can speak for myself, like how I loved being home for a year. I thought this was the best thing ever. I never thought I'd have that opportunity. And it's definitely shifted over the past few months of like, I really want to be back in the office. Yesterday I hit this low of dogs barking, children screaming, they're mowing the lawn. And I'm like, I'm just trying to do my work, right? Really could feel that pull. So we have different complicated views that change, right? And so just first of all, recognizing we're all in different places, and interpersonally and also intrapersonally, ourselves included, we may be changing day to day. So what are the facts to consider? And again, the data can help us to really think through, because it can feel so overwhelming to make decisions. So what are things we want to really look at? So number one is our safety and well-being. Employees need to feel like their well-being is being considered. That's the number one complaint I hear from employees is, my boss doesn't think, they don't care about our well-being. They're dismissing our concerns. And that can feel like really disempowering and create less engagement, feeling that, that engagement back and forth that we talked about. So what is the safety, health, and well-being of our employees? We already know our folks are struggling. The data tells us this. So there's a lot of discomfort returning, that anticipatory anxiety, the state of the vaccines and variants. Then we have these evolving state and federal guidelines, and even our office layouts, like what that looks like. So that's always important, is to be able to have these points at least articulated, right? Not ignoring or, pretending these don't exist, but actually recognizing them, saying them out loud, using metrics to help define what the policies are. And the second part is equally important, which is like that sense of belonging. How do we foster this, either with a hybrid model or still staying virtual or returning back to work? Engagement, right? Remember, we have 80% of folks don't feel engaged in their employment right now. So we have lots of room to help facilitate engagement. How do we do that? Collaboration and teamwork. What does that look like, especially virtually? Productivity versus safety, right? All of these things that we're weighing back and forth. And then retention and recruitment. That's changed dramatically, right? I was just doing a consult where we were talking about quitting by text, and how people, it's harder to retain employees during this time, right? And it's harder to find a job for those of us who are looking for jobs. So these are facts to consider, and facts to, I would say, explicitly consider, to talk about it among your workforce, so that everyone is really seeing that their views matter, their safety matters. I want to spend some time talking about anticipatory anxiety. I think if I did a survey with this group today, we probably would all raise our hand and say we've had anticipatory anxiety at some point over the past year. Certainly the data supports that from that Gallup poll. In the psychology world, the American Psychological Association has looked at anticipatory anxiety and found somewhere around 80% of Americans have had anticipatory anxiety over the past year. So that's huge. Now, what is anticipatory anxiety? How is it different than just your run-of-the-mill anxiety? The key is uncertainty. So we can feel anxious about giving a talk. We can feel anxious about a medical report, right? We can feel anxious about something new that we're going to be doing. But there's a particular flavor to anticipatory anxiety that I want to just really flesh out, so we can have a lot of compassion for ourselves and also understand why our employees may be struggling. So it's the uncertainty that really ratchets up the nervous system. The more uncertain we are, the less that we can prepare, right? And we end up going into some default strategies that are actually less helpful than we think. the link between anticipatory anxiety, depression, physical illness, panic attack, and even anger, some of those Gallup poll findings is high. So when someone has anxiety, they typically have other co-occurring mental health challenges, right? And so again, key issue for over half, and some of the data is saying, nearly 3/4 of us are having some anticipatory anxiety. So what does it look like? Well, what happens, this is where our strategies as humans are sometimes less than helpful, even though we feel like they might be helpful. Number one is we have a lot of uncontrollable worries with anticipatory anxiety. What if I get sick? I'm going to use pandemic examples here. Sometimes that can cause us to have increased threat attention and hypervigilance. So in the beginning of the pandemic, some of us might have been checking their temperatures all the time. That's what I used to do. Or we might be getting COVID tested a lot, right? Or we're doing a lot of avoiding, right? We're avoiding situations. Or it can be the opposite. Sometimes it's like, oh, it's fine, right? So we call it deficient learning, right? Not following protocols, saying it's not going to happen, or just this fait accompli, I'm going to get it anyway, so it doesn't matter. So there's something about like deficient learning. We're not learning, we're not utilizing the data to support good decision making. Avoidance. So when we're anxious, we want to avoid things that cause us anxiety. I'll say that again because it's really important. When we're anxious, we want to avoid things that cause anxiety. And in fact, when we avoid them, we do feel better momentarily. So if we avoid something like not taking a test, or we avoid something that that's difficult to do, we might feel like, oh good, don't have to face that today. And then the next time it comes up, it actually could even be a stronger anxiety. The more we avoid, the more anxiety we have, and we repeat this cycle of avoidance to the point where we can get immobilized sometimes. Finally, this heightened reactivity to threat. And this is what we see when people return to the workplace without sufficient attention to anxiety, is people get panicky. They get really anxious. Nervous systems are already on high alert during this time. Then you add in a return to work with someone who's recently exposed to COVID, or a building that has poor ventilation, things like that, where one's safety feels at risk, and it can create even more anxiety. So we want to mitigate some of the anticipatory anxiety, or at least pay attention to it. When we pay attention to it, we can actually use strategies that can help decrease some of the impact. So how do we know when we're having job-related anticipatory anxiety, burnout, stress? These are things, and I want you to consider for yourself, your employees that you're working with. And some of these are harder to tell virtually, right? If you are in a workplace that is primarily virtual. Absenteeism, well, what does that look like? Sometimes you can go days without seeing someone and we may not know that they're even absent. Anger and irritability, right? I have opposing counsel and judges because I often share this with my lawyers that I work with. And we can think about that with many of the people we work with. Are we more irritable? Are our emails shorter, right? Are we, kind of more clipped? And sometimes people don't even notice that, right? But we feel it internally. Indecisiveness, difficulty making decisions, decreased productivity and efficiency, avoidance of certain clients, certain situations, certain jobs, lack of diligence, like our work is suffering a little bit, overwhelmed by the demands of life, questioning, why am I in this job to begin with, right? And finally, feeling trapped or stuck. So these are signs that we might have in ourselves, or we might be seeing them in colleagues or coworkers. And, we want to actually pay attention. These are all important signals. If we don't pay attention to them, we can get to a point where people either have a mental health crisis or quit the job or end up, getting fired because these are contributing to poorer and poorer performance, right? So none of these should there's no shame attached to any of these. These are all just normal responses to incredibly high levels of stress. And when we can take the stigma out of these and actually make them part of our regular discussion, which we'll talk about in a moment, we're going to end up having a healthier workplace. So again, these are things just to look for in yourself and in your colleagues, particularly during these uncertain times. Okay, these are all things just to look through and to regularly assess for yourself, right? All right, so how do we then? So given that our workplace is struggling, There's a lack of engagement that employees are feeling toward their job. Employees are struggling as well to know what to do. We have anticipatory anxiety, and now we're back into another, sort of wave of the pandemic. So how do we manage this? So one is to actually start with the anxiety. So of course, as a psychologist, I always like to start with the psychology piece, but it's really important because if we want to be flexible, which is the idea of navigating the ups and downs, we actually need to be as healthy as we can. Without skills, and the thing is, without giving people skills and actually giving people ways, reboarding is going to create even more stress and could create job loss or decreased productivity. If people are returning to work and they feel that their employers are not caring for them or that they're at risk, right? So it really is key during these uncertain times to start with the well-being of ourselves, our employees, if you're an employer, yourself as well. So we're talking about the whole system of like, well, how do we actually take care of ourselves during this time? When we are stable, meaning when we have the capacity to manage stress relatively effectively, I mean, no one's superhuman, but relatively effectively, we actually have the ability to work together in a more effective way and even use this as an opportunity. So the first thing I'd like to talk about is how do we actually even know how stressed we are? And what always strikes me is I often get people in my therapy office, my virtual therapy office, who have been stressed for so long, it takes a crisis to reach out for help. And many times they'll say, I should have done this months ago, but I didn't. But then finally my boss told me I have to get some psychological help. So we're going to talk in a moment about tracking our stress level, actually looking at like, how stressed am I? We hold a tremendous amount of stress before it makes it into our conscious awareness. A personal self-care plan to manage stress. We can't handle these challenging times unless we have a personal care plan. It's almost non-negotiable. When you look at the data from that Gallup poll, we have to be able to take care of ourselves. We'll talk about some of our mindfulness and self-compassion practices because they are so key to helping with this anticipatory anxiety. And then we'll talk about when do you seek help and what kind of help do you need if your anxiety is continuing? And for many of us, that may be a real decision point. Like if these self-help skills or self-assessment and care, kind of self-care package that alone doesn't help you, what do you do? And then finally, looking at our overall well-being, not just in the workplace, but in 5 key areas that help us be a more productive workplace on the whole. All right, so self-assessment. So again, as a psychologist, we love to do assessments because they give us data before, during, and after an intervention. So these are some measures that I ask people to sometimes take. Perceived stress scale is one of my favorites, called the PSS, and these are all freely offered. You can take them. They're psychologically studied. They've been normed, meaning that they've been tested on lots of people to be pretty effective in measuring different levels of stress. So we have a depression, anxiety stress scale. We have a life stress survey, the perceived stress scale, and then you can create your own. I often do this for some of my clients, a little bit more fun. What's my own stress scale? And sometimes you might want to do both so you can look at what's unique to you when you're stressed, because that might look different. When we can track our anxiety, we actually can see if what we're doing is working or not. So if your stress level is like at a 10, and then you do some let's say self-compassion or some meditation or yoga, and your stress level goes down to a 7, that may not be perfect, but you're going in the right direction. If you don't measure, how you're doing, there's no way to know, right? And sometimes we actually don't realize we are doing better when we're using certain techniques, right? So that can help us with maintaining a regular self-care practice when we can see the data supporting, hey, this is working. Also, this is helpful if you're not even sure if you're struggling or not. When I give people self-inventories, and I do this sometimes for anxiety, depression, sometimes alcohol use, people will come back and go, wow, I didn't realize, like, this is really high. I didn't realize how high it was. And that often is a light bulb moment of like, yeah, actually I need support. So what does the self-care plan look like? So once we assess our stress level, our depression level, our substance use level, we can say any of those, our satisfaction level, then we can really figure out what is our self-care plan. We know, that mindfulness is going to be a piece of this. Well, I'll assume, because mindfulness really is so helpful in anticipatory anxiety and well-being. So we'll talk about that in a moment. But it's also other things too, right? It's going to be, how do I feel valued? How am I working on my spiritual life? How am I working on my community life? We know that when people are happier, they're less likely to utilize substances, eating unhealthy. So we want to work on, like, what does my overall well-being look like? So I like these self-care plans of actually writing out, and sometimes you can do this on your own, or sometimes you might do this with a coach or a clinician to really look at, well, what do I need to do on a daily basis to feel better? We often trust ourselves. We say, oh, I'll do that. I'll download that app. I'll do it at some point. But unless we actually create a plan, we're not going to do it. Human nature is such that we often have the best intentions, but unless there's an actual structured routine, and usually we have to do it for about 2 or 3 weeks, then we can trust ourselves that we may continue that practice, right? So what is mindfulness? Why am I tying that in and saying, of course, mindfulness? So we know that mindfulness can reduce psychological distress, can decrease depression severity, can help us manage anxiety, help us with our attention and focus and well-being. So this fits beautifully. Like, we know that this is one of the tools that can help us so that we can navigate stress. When we have better attention and focus, when we feel like there's some well-being, when we are not in a fight or flight alarm, we can think better, we can problem solve better, we're more productive. So even with the most challenging situations, we have more capacity to manage. Psychological flexibility has also been shown to be improved when we are doing mindfulness practices, which means the capacity to change, to switch directions. Again, very necessary during this pandemic. Many of you know this already. I'll just briefly talk about mindfulness, paying attention on purpose in the present moment, non-judgmentally. And when we're anxious and when we're depressed and feeling disengaged, the judgment can be very, very high. We can judge ourselves very harshly. So these practices are friendly practices designed to help us feel connected to ourselves rather than alienated from ourselves. So meditation, Studio B has these lovely short practices, and I'm really enjoying practicing them myself and also leading these for people. 5 minutes of practice, sometimes even a quick in the moment practice of regulating the breath and feeling the body in this present moment using the senses. We can do this, on and on and on for hours at a time. But right now we're talking about consistent, several times a day, ultimately doing some short practices so that we can actually regulate our anxiety. We know that the more present we are, the more we're able to navigate and make decisions. This study I love to share, which was done in 2010, looking at how often our minds wander. And I would say that's probably even worse now. In 2010, prior to the pandemic, these researchers out of Harvard had an app, and they were asking people throughout the day, how are you feeling right now? What are you doing right now? And are you thinking about something other than what you're doing? They found that our minds wander almost half the time, no matter what we're doing. They also found that the more our minds wander, the less happy we are. So we know when we pay attention, it allows us to be more flexible, happier, more focused, which is good medicine when we're struggling with the pandemic. So I want to just kind of move through to talk about mental health supports also as we navigate. If this is something you haven't considered before, it's something really important to think through of, like, what is available to my staff, or what is available in my company or organization? When do I ask for help? That's why I like to do those assessments. It can be helpful just to know I'm really struggling, so I might need more assistance. So we have the EAPs, which are short term, often, somewhere between 1 and 10 sessions. That many employers offer to work with a counselor. Coaching can be very helpful, especially if it's around work performance. I think about work performance lends itself beautifully to coaching. Psychotherapy lends itself beautifully when it's more of the anxiety, depression, and sometimes both, right? But working with a mental health professional, if you're noticing some of those signs and symptoms, can be really helpful. And I love peer support groups, getting folks together that are in the same boat and problem solving together. It's really empowering. Mindfulness meditation groups, that idea of being connected to other people can be so valuable when we're struggling. All right, let's see. Just a couple of more things. So I want to talk about what is well-being for a workforce. And here's this interesting opportunity again. I think about these challenging times, and this idea of reboarding gives us an opportunity to really think about how do we actually make a workforce well? And the studies are showing that it isn't just about the job, right? And it isn't just about mental health. It's about these 5 elements. One is career well-being. Do I feel well in this job? Which I would talk about in terms of engaged. Do I feel like I'm enjoying my job? Does it feel like what I'm doing matters, right? Community well-being. Am I contributing to the community in some way? Do I feel a part of, connected to the community? Social well-being. How's my interpersonal life right now? Am I getting, enough care? I was talking to a young attorney yesterday, and she said, I don't think I've really actually even touched anybody in the last 6 months. She has a partner who she's seeing virtually. She lives alone. And we think about she said, oh, but I'm getting my social needs met. We both paused for a moment because when we actually broke that down, she wasn't. She actually was missing a lot of contact. Financial well-being, right? We know that we need to feel at least having a basic amount so that we're not having that ongoing stress. And then physical well-being. So all of these actually contribute to a workforce. In the past, most of our workforce, we might focus on the career well-being and maybe a little bit on, of course, on financial. The rest maybe come and go, right? And now there's this opportunity to think about, well, wait, how do we focus on not just our career well-being, but community? What's the community aspect? How do we increase interpersonal connection, physical well-being, mental well-being? All of those go together to actually create a healthier workforce. And this opportunity now. It's like almost a mandate when you look at that Gallup poll data, right? We can't continue the way we're continuing. Our workforce is going to become sicker and sicker, and being able to maintain quality work is going to decrease. So people thrive when they have all 5 areas working for them. Employees are thriving more when they are engaged, right? And they're less prone to burnout. They're able to navigate the challenges much more effectively. So employers, whether you're an employee or employer, we want to focus on well-being. It's actually the key to keeping people going during this pandemic and beyond, right? A thriving workforce is a wonderful goal. We never thought about that prior to the pandemic, or a little bit, but not in such stark terms. And the need is more than ever. So here's some strategies, just a beginning discussion. The first thing, and I really highly recommend this for employers and employees, is to get together and talk about what is the toll. It really matters for people to share their story, share their impact, that it's what's happened to them. And we can gain so much from just hearing each other and honest recognition, acknowledgement. This is how it's been. This flexibility, the more that we have choices, the more that people's anticipatory anxiety decreases. So that flexibility, and again, here we are again pivoting through this difficult time with the pandemic. How much flexibility can you have as an employer and as an employee to navigate and say, for this week, it's like this, or here's another option. So when people have choices, they feel less stressed. I love this idea of a soft landing, partial return. It's almost like giving your nervous system time to adjust. I did this myself. I was hired during the pandemic and had never been to my office. I was hired a year ago. And so I went in over the weekend just to look at this office. It's in a big downtown office building in Boston, beautiful building. And I found myself anxious, but also like, okay, this is what it's like to go in the elevator. This is what it's like to go. And these small things can make a big difference. So this partial return, allowing the nervous system to catch up, to be able to anticipate what might be anxiety provoking, and then to gently work your way through it. Checking in on each other. If you look at that list of warning signs for employees, asking each other, if you're noticing, hey, I haven't seen so-and-so in a while, or this person doesn't see themselves, it makes a huge difference to the culture you're working with. We want to check on each other, and it's so easy to ghost and go very much under the radar when we're all virtual. And so if that's the case, you're remaining virtual, how do we still do check-ins with each other? And then not to underutilize resources, EAP, therapy, and coaching, my three. These exist for a reason. And, if someone had high blood pressure or diabetes and their numbers were as high as people's stress level, we would have them in the emergency room. We'd have them right to their primary care doctor. But mental health, well-being, it's like, oh, it's sort of not as important. I like to think about it in the same way. So if you see that someone's struggling, or you yourself have benefited, share that experience. That helps to normalize. And so that your employer or employees are more receptive if they know, oh, so-and-so also is getting support, or I didn't even know this existed. I can get 3 or 4 sessions for free and not even use my insurance, right? As a therapist, so much therapy is telehealth still, which is great. It's a lot more accessible. Many therapists are saying, yeah, I can, I'm booked up, but I can see a few people on virtual if that's an option. So thriving, this idea also that we are not going to be in the pandemic forever. And so helping employees know that their long-term career matters, right? How do we focus on their strengths? What ongoing support can we give people? So even during this difficult time, there's a sense of mobility, there's a sense of going somewhere. I love this idea of family-friendly policies. How do we actually create friendships? Again, if you've been hired during the pandemic or working, how do we create connections even during these difficult times? Looking at the financial services and education opportunities, so important right now. Physical activity, stress reduction. So all of the Studio B offerings, that idea of it's just readily accessible so that it's not like hard to find. How do we even start? Well, it's right here. It starts with this one simple practice. And then helping celebrate other people. I find this to be so valuable, especially when people are doing community-based services, like letting people know about that and really recognizing people that are doing so much. Remember the beginning of the pandemic, how healthcare workers were getting so much, celebration, rightly so. And when we do that, it can make people feel like, wow, my job matters. We all need to feel like that, right? No matter what job we do. And we also want to celebrate the small things that people are doing every day to help in their community. Compassionate workplace, final thing I want to share is just about this other idea, again, being a role model to have a kinder, gentler direction. We want to do a lot of active listening. People need to feel heard and understood. Active listening means just listening, acknowledging, validating. Feedback, we have to be really compassionate with our feedback. I'd like to talk about a 5-to-1 ratio, which means that if we're going to give correction, which we do need to do, we want to make sure we're also recognizing people's nervous systems need to hear good things too. Otherwise, we get stuck on the negative. And finally, noticing when colleagues are struggling, right? And we really want to give them compassion. We want to invite them to utilize some of the resources available, both in terms of like a platform like Studio B, but also working with an individual mental health professional. So as we get through this pandemic, thinking about Joan Halifax, who's a Zen teacher, she says, we believe that it takes a strong back and a soft front to face the world, right? And so that strong back is this idea of our well-being, soft front, allowing ourselves to have compassion and space and self-care. All right, I'm going to stop sharing here. So I know, again, I sometimes feel like I'm going through the slides on a fast level, but I want to pause and see if there's any questions or thoughts about anything I've shared so far today. As you may be thinking about it, this is going to be part of a 3-part series. And when we were talking about this at Studio B, we really wanted to have this idea of an overall discussion about the state of where we are. And then the next webinar geared toward employers to help really think through as an employer, what are some of the challenges to support the workplace? And then as an employee for the final webinar. So to really focus on what do we need to do as an employee to take care of ourselves during this time. So taking all of those and breaking them down so that each group has an opportunity to really get some ideas and strategies. Oh, thanks, Paula. I just saw Paula put it in chat. Yeah, so Yes, if anyone has any questions or any ideas they'd like to share or any specific things you'd want to have included in those upcoming webinars, I'm really open to that and want to really make sure that we are providing as much support as we can to employers and employees during this difficult time.
Thanks, Tracy. There's a question in the chat that maybe I can relay if that's helpful.
Sure. Yeah.
Lindsay asks, this has been extremely helpful. Can you expand a little more on coaching, in parentheses, work performance?
Hmm. Yeah. So I love the idea of looking at thriving, right? And coaching can really take the coaching model is really about not so much someone telling you what to do, but helping to empower the person. And so it's about like what make, the very basic is like what makes you thrive, what helps you to get to a place where you're functioning well in those 5 areas of well-being. So coaching can be really helpful because it's very goal oriented. Sometimes when people go to psychotherapy, we can spend months working on particular issues, which is great. Coaching is very targeted and it's goal oriented and usually working collaboratively to find specific steps to reach those goals. So if you have targeted things that you want to address and really focus on that thriving in the workplace, I think coaching can be really valuable for that. And some people do both. The difference between psychotherapy and coaching is sometimes confusing, but I spelled out a little bit in here, especially if you're thinking more about how mental health is contributing to not doing well on the job or struggling, then I would definitely recommend more of the psychotherapy avenue. If it's more about related to job performance, future goals, redirection, creating some new skills, I love the idea of coaching, and they can intersect beautifully as well. And I think about like Studio B and the mindfulness platform as an intersection for both, right? If you think about 3 concentric circles, we've got mindfulness and compassion practices and well-being in the middle for both individual therapy and coaching. So any other questions or thoughts? Well, I wish everyone a safe rest of the month and continuing to work together as we're all creating this new well-being and hopefully new thriving in our pandemic and post-pandemic workforce. So thank you so much for joining today. I look forward to seeing you again in October. Thank you.